Now, let's look at the veins, arteries, and nerves of the shoulder region. As you'll see, the main bundle of vessels and nerves lies behind the clavicle and behind both pectoral muscles as it passes from the base of the neck to the underside of the upper arm. To understand how things are arranged up here, where the main vessels come up out of the chest and the main nerves emerge from the vertebral column, there are some key structures that we need to understand. The first ribs, the cervical vertebrae, and the scalene muscles. Let's take a look at them. Here's the first rib, below and behind the clavicle. This much of it is bone, and this much of it is costal cartilage. The two first ribs define the opening at the top of the chest, the superior thoracic aperture. The main artery to the upper extremity, the subclavian artery, crosses the first rib here. The subclavian vein crosses it here, right behind the medial end of the clavicle. Here are the vertebrae, the first thoracic with the first rib, and the seventh, sixth, and fifth cervical. Let's take the clavicle away so that we can see the vertebrae better. The main spinal nerves to the upper extremity emerge here, between the transverse processes. The spinal nerves that we're concerned with are numbered C5, C6, C7, C8, and T1. These two landmark muscles, the anterior scalene and the middle scalene, which are attached to the first rib here and here, guard the exit of these vital structures. The vein runs in front of the anterior scalene, the artery runs behind it. Between the two scalene muscles, the roots of the brachial plexus also emerge. There are two possibly confusing things that we have to live with. The first is that there's a nerve root named C8, even though there's no eighth cervical vertebra. The second confusing thing is that the main artery and vein change their names as they go along. Here they're called the subclavian vessels, here they're called the axillary vessels, and from here on down they're called the brachial vessels. The structures themselves don't change, just the names. Let's start by looking at the veins. We can be quite brief about this since the veins parallel the arteries in most important respects. It'll be helpful to start on the outside and progress inward, removing some muscles as we go along. Here, in the groove between pectoralis major and deltoid, is the cephalic vein coming up from the arm. It's a vein that doesn't have an accompanying artery. To see where it's going, we'll remove pectoralis major. Here's the cephalic vein. Together with other veins from the shoulder region, it joins the main vein of the upper extremity, the subclavian vein. We'll focus our attention on this important vein. The subclavian vein comes up from the arm and passes beneath pectoralis minor. Emerging from beneath pectoralis minor, it passes over the outer surface of the first rib. Here's the first rib, and under the subclavius muscle and the clavicle. To follow the subclavian vein further, we'll remove the clavicle, the subclavius muscle, and this muscle, the sternocleidomastoid. Here we are behind the medial end of the clavicle, which went from here, this is the cut end of the clavicle, to here. This was the sternoclavicular joint. Here's pectoralis minor. Here's the curve of the first rib. And here's scalenus anterior. These structures, the subclavian artery and the brachial plexus, we'll be seeing in a minute. Let's follow the vein. Just as the subclavian vein reaches the medial border of the first rib, which is here, it's joined from above by the main vein of the head and neck, the internal jugular vein. Together, the subclavian and internal jugular veins form the brachiocephalic vein. The brachiocephalic vein passes medial to the first rib and enters the chest. The dome of the pleura lies immediately behind it. Here's the pleura. To follow the brachiocephalic vein into the chest, we'll remove these muscles. And we'll also remove this part of the anterior chest wall. We'll also remove the other clavicle. Now we're looking inside the chest. Here are the divided ends of the two first ribs. And here's the divided end of the sternum. Here are the two brachiocephalic veins, the right and the left. A little to the right of the midline, they join together to form the superior vena cava. Apart from what we've just seen, the veins of the region correspond so closely to the arteries that we don't need to consider them separately. We'll move on now to look at the arteries. In the dissections that follow, all the accompanying veins have been removed to simplify the picture. To get a good look at the artery as it runs from here to here, we need to remove pectoralis major. Now only three structures stand between us and it. Here's the artery, passing behind the anterior scalene muscle, behind the clavicle, and behind pectoralis minor. Three names for one artery: subclavian, axillary, brachial. Let's see where it begins. Here's a deeper dissection with the chest wall removed. Here are the divided ends of the clavicle, the first rib with the anterior scalene muscle, and the second rib. In the middle, we're looking at the trachea and the common carotid arteries, the right and the left. On the right side, the subclavian artery arises, along with the common carotid, from the brachiocephalic trunk, which in turn arises from the arch of the aorta. On the left side, the subclavian artery arises directly from the arch of the aorta. In the early part of its course, as it passes over the dome of the pleura, the subclavian artery gives off some major branches, which we'll see in other parts of the atlas. These are the internal thoracic, the thyrocervical trunk, and the vertebral. In addition, the subclavian gives off two branches to the back and shoulder region. These are the transverse cervical and the suprascapular arteries. These two are variable. Sometimes they arise here, sometimes here. The main artery, now called the axillary, next gives off two branches behind pectoralis minor. They're the thoracoacromial and the lateral thoracic arteries. In the axilla, three more branches arise, often close together: the subscapular and the two circumflex humeral arteries, the anterior and the posterior. The posterior circumflex humeral winds round behind the neck of the humerus. Finally, the artery, now known as the brachial artery, passes on down the upper arm. Now let's look at the nerves. Between about here and here, the 5 spinal nerves unite and divide, unite again and divide again. The tangle which this produces is called the brachial plexus. It's not really too formidable. At the end of the brachial plexus, the 4 main nerves of the arm emerge: the musculocutaneous, the median, the ulnar, and the radial. In the course of the brachial plexus, the nerves which supply the shoulder region are given off. We'll look at the main components of the brachial plexus first, then at the local branches. Here's the brachial plexus, with several of its small branches removed, so we can see the big picture. We'll also remove pectoralis minor. Here are the 5 roots of the brachial plexus. They are in fact the ventral rami of their respective spinal nerves. They emerge, as we've seen, from between the anterior scalene and middle scalene muscles. The top 2 roots join, and the bottom 2 join, and the middle one, C7, stays alone. These 3 big units are called the 3 trunks: upper, middle, and lower. Each trunk divides. Here's one of them dividing into an anterior and a posterior division. Of the 3 anterior divisions, the upper 2 unite, and the lower one stays alone. The 3 posterior divisions all unite, as we'll see in a minute. Once that's all happened, there are again three big units now called cords: lateral, medial, and posterior. They surround the axillary artery. The lateral cord divides to become the musculocutaneous nerve and one half of the median nerve. The medial cord divides to become the ulnar nerve and the other half of the median nerve. This arrangement produces an M-shaped pattern of nerves: musculocutaneous, median, and ulnar. Now let's see the posterior cord. We need to remove the medial cord, the lateral cord, and the artery to get a good look at it. Here's the posterior cord all by itself. Sometimes it starts dividing before all three of its posterior divisions have united. Its principal branches are the axillary nerve, which we'll see again, and the radial nerve. Now that we've looked at the main components of the brachial plexus, let's look at the nerves which supply the muscles of the shoulder region. Some of these arise from the cords of the brachial plexus. Some arise in other ways. Let's look at the ones that arise from the cords first. We were looking at a simplified dissection before. Now we'll see the details. The medial cord gives rise to one local nerve, the lateral cord to two. The one from the medial cord is the medial pectoral nerve. It's one of a pair. Here's its partner, the lateral pectoral nerve, which arises from the lateral cord. The pectoral nerves supply pectoralis major and pectoralis minor. Also arising from the lateral cord is the musculocutaneous nerve. It supplies three upper arm muscles, one of which we've seen, coracobrachialis. The other two we'll see in the next section. The posterior cord, here it is again with all its branches intact, has four branches. The axillary nerve runs round the neck of the humerus, along with the posterior circumflex humeral artery, to supply the deltoid muscle and also teres minor. The subscapular nerves, an upper and a lower, supply subscapularis and teres major. The thoracodorsal nerve supplies latissimus dorsi. Now let's see the shoulder muscle nerves which don't arise from the cords of the brachial plexus. Of these, one is the branch of a trunk, two arise from the roots of the brachial plexus, and two aren't part of the plexus at all. Arising from the upper trunk is the suprascapular nerve, which supplies supraspinatus and infraspinatus. Arising from the C5 root and passing through the middle scalene muscle is the dorsal scapular nerve. It supplies the rhomboid muscles. Arising from the C5, 6, and 7 roots, the long thoracic nerve emerges through the middle scalene muscle, runs deep to all three trunks of the brachial plexus, and supplies serratus anterior. Trapezius gets its nerve supply from the spinal accessory nerve. Lastly, levator scapulae gets a private nerve supply from the nearby roots of C3, 4, and 5. We've looked at some pretty complex and detailed anatomy in the last few minutes. Let's review what we've seen of the veins, arteries, and nerves of the shoulder region. First, the few veins that we saw. The cephalic, subclavian, and brachiocephalic veins. Next, the arteries. The brachiocephalic trunk, the subclavian artery, the axillary artery, the brachial artery, the transverse cervical and suprascapular arteries, the thoracoacromial, lateral thoracic, subscapular, anterior, and posterior circumflex humeral arteries. Lastly, nerves, starting with the main components of the brachial plexus, the roots of the brachial plexus, C5, C6, C7, C8, and T1. The three trunks, upper, middle, and lower. Each trunk splitting into divisions, an anterior and a posterior. From the three divisions, three chords arising, the lateral and medial from the anterior divisions and the posterior from the posterior divisions, arising from the lateral chord and the medial chord, the musculocutaneous, median, and ulnar nerves, and the pectoral nerves, the medial and the lateral, arising from the posterior chord, the axillary and radial nerves, also the subscapular and thoracodorsal nerves, arising higher up, the suprascapular, the long thoracic, and the spinal accessory nerve. Now, let's move on to look at the vessels and nerves of the region. We'll go from the shoulder to just below the elbow. First, we'll look at the veins. Many superficial veins from the forearm converge just below the elbow to form two large veins, the basilic and the cephalic. The cephalic vein stays at a superficial level as it runs up the arm over the biceps. At the top of the arm, it lies between the deltoid and pectoralis major. The large vein crossing the front of the elbow is the antecubital vein. It crosses from the cephalic to the basilic vein. The basilic vein then runs up the medial aspect of the arm to join this brachial vein, which is one of a pair. The two brachial veins join together as they pass up the arm. Here they are joining to become one brachial vein. The name of this vein then changes. Up here, it becomes the axillary vein. To get a good look at it proximally, we'll remove pectoralis major. Here's the axillary vein running alongside the median nerve and the axillary artery, and disappearing with them behind pectoralis minor. Now, let's look at the artery and the principal nerves of the arm. From here on, the veins which run parallel to the arteries have been removed to simplify the picture. Here's the main artery, the axillary artery. It emerges from beneath pectoralis minor, surrounded by major nerves. As it passes into the arm, its name changes. From here on down, it's the brachial artery. Here, right next to the latissimus tendon, it gives off a large branch, the deep brachial or profunda brachii, which passes backward deep to the triceps. Along with it goes the radial nerve, which we'll see in a minute. The brachial artery runs down the medial side of the arm, alongside the brachialis muscle. The median nerve crosses over the artery. The brachial artery passes beneath the bicipital aponeurosis, which we'll remove. Alongside the biceps tendon, the brachial artery divides into the two major arteries of the forearm, the radial and the ulnar. The radial artery stays quite superficial. It runs down the forearm between pronator teres and brachioradialis. The ulnar artery has a much deeper course. It dives down alongside the brachialis tendon and passes deep to pronator teres. We'll leave the arteries there. We'll see their further course in the next section. Now we'll go back up to the top and look at the nerves. 4 nerves surround the axillary artery as it emerges from beneath pectoralis minor. They're the musculocutaneous, the median, the ulnar, and the radial. We'll look at them in that order. Here's the musculocutaneous nerve. It supplies 3 flexor muscles in the arm, the first of which is a shoulder flexor, coracobrachialis. The musculocutaneous nerve runs right through coracobrachialis and emerges here, deep to the biceps. It runs down the arm between biceps and brachialis, supplying both muscles. It emerges here to become the lateral cutaneous nerve of the forearm. The median nerve and the ulnar nerve Both run all the way down to the elbow without supplying anything. They start out close together. Halfway down the arm, they diverge. The median nerve stays close to the brachial artery, crossing in front of it. At the elbow, it lies medial to the artery. It dives down between the brachialis tendon and pronator teres and passes between the two heads of pronator teres to enter the forearm. The ulnar nerve slants backwards. It runs down just medial to the triceps tendon and behind the medial epicondyle. It turns a sharp corner round the underside of the medial epicondyle, where there's a fibrous tunnel for it. It passes between the two heads of flexor carpi ulnaris to enter the forearm. Once they get below the elbow, the median and ulnar nerves get busy. Between them, they supply all the flexor and pronator muscles of the forearm. Of the muscles that we've seen already, the median nerve supplies 4: pronator teres, flexor carpi radialis, palmaris longus, and pronator quadratus. The ulnar nerve supplies 1 muscle that we've seen so far, flexor carpi ulnaris. Lastly, let's look at the radial nerve. It has a long spiral course from here round to here. Up here, the radial nerve lies behind all the other nerves and vessels. Just below the latissimus tendon, it runs back between the long head and medial head of triceps. To follow its course, we need to go right round to the back and find the same spot again from behind. Here's the long head of triceps, here's the medial head, and here's the radial nerve. To see where it goes next, we'll remove the long head of triceps. As the radial nerve passes round the humerus, it lies right on the bone. It runs between the medial and lateral heads of triceps, then runs beneath the lateral head to emerge here, still right on the bone, just above brachioradialis. Under cover of brachioradialis, it reaches the lateral epicondyle, where it divides into a deep or motor branch and a superficial or sensory branch. That's as far as we'll follow the radial nerve for now. Of the muscles that we've seen, the radial nerve supplies the triceps, anconeus, brachioradialis, all 3 wrist extensors, and supinator. To end this section, let's briefly review first the vessels and then the nerves from the shoulder to the elbow. Here's the cephalic vein and the basilic vein, the antecubital vein, the brachial vein, and the axillary vein. Here's the axillary artery, the brachial artery, the profunda brachii artery. At the elbow, the radial artery and the ulnar artery. Now the nerves. Here's the musculocutaneous nerve, the median nerve, the ulnar nerve, and the radial nerve, with its superficial branch and its deep branch. Back of the thumb and part of the back of the index. The deep branch of the radial nerve, also known as the posterior interosseous nerve, is a motor nerve. It passes through the supinator and emerges here, deep to extensor digitorum. It breaks up into several branches. Between them, these supply extensor carpi ulnaris, extensor digitorum and the other 2 finger extensors, and these three long thumb muscles, abductor pollicis longus and extensor pollicis brevis and longus. Now let's look at the median nerve. Let's go back to the elbow where we saw it in the last section. Here's the median nerve, next to the brachial artery. To see where it's going, we'll retract flexor carpi radialis. The median nerve first dives between the two heads of pronator teres. It then immediately passes between the two heads of flexor digitorum superficialis. The median nerve, here it is, passes down the forearm between flexor digitorum superficialis and profundus. It emerges at the wrist to the radial side of the superficialis tendons. It's crossed by the tendons of palmaris longus and flexor carpi radialis. The median nerve passes through the carpal tunnel to reach the hand. It lies just beneath the palmar aponeurosis, which has been removed here. The median nerve gives off this small motor branch to the thenar muscles and then gives off these three common digital nerves. The common digital nerves break up into palmar digital nerves, two each for the thumb, index, and middle fingers, and usually one for the radial side of the ring finger. The medial nerve typically provides sensation to the medial half of the palm, the flexor aspect of the thumb, the index and middle fingers, and the radial side of the ring finger. Of the extrinsic hand muscles, the median nerve supplies flexor digitorum superficialis, flexor pollicis longus, and the radial half of flexor digitorum profundus. Of the intrinsic hand muscles, it supplies only the three thenar muscles and the radial two lumbricals. Lastly, let's look at the ulnar nerve. As you'll recall from the last section, the ulnar nerve enters the forearm by passing round the medial epicondyle and between the two heads of flexor carpi ulnaris. Here's the ulnar nerve. It runs down the forearm between flexor carpi ulnaris and flexor digitorum superficialis, with profundus deep to it. Here it gives off a dorsal sensory branch, which goes to the back of the hand. At the wrist, it runs along the radial side of flexor carpi ulnaris. Along with the ulnar artery, it passes through the side tunnel in the edge of the flexor retinaculum. Here it is emerging from the tunnel. As before, the palmar aponeurosis has been removed. The ulnar nerve divides into a superficial branch and a deep branch. The superficial branch divides into palmar digital nerves for the little finger and typically the ulnar side of the ring finger. The deep branch passes between the hypothenar muscles. To follow it, we'll remove the flexor tendons. The deep branch of the ulnar nerve runs across the palm in front of the interossei. It passes in between the two heads of adductor pollicis. We'll remove the transverse head to reach the most radial of the interossei. The ulnar nerve typically provides sensation to the ulnar half of the back and the front of the hand, and to the little finger and the ulnar half of the ring finger. Of the extrinsic hand muscles, the ulnar nerve supplies only the ulnar half of the flexor digitorum profundus. Of the intrinsic hand muscles, it supplies the hypothenar muscles, all the interossei, adductor pollicis, and the ulnar two lumbricals. Before we move on to look at the skin of the hand, let's briefly review what we've seen of the vessels and nerves. Here's the cephalic vein, the basilic vein, and the antecubital vein. Here's the radial artery in the forearm and at the wrist. The ulnar artery in the forearm and at the wrist. the superficial palmar arch, common digital arteries and digital arteries, and the deep palmar arch. Here's the radial nerve with its deep branch and its superficial branch. Here's the median nerve in the forearm and at the wrist, with its motor branch, the common digital nerves, and digital nerves. Here's the ulnar nerve in the forearm. Here's its dorsal sensory branch. Here's the ulnar nerve at the wrist with its superficial branch and its deep branch. Here's the distribution of the radial nerve, the median nerve, and the ulnar nerve.